If you suffer with loose dentures or you are embarrassed to smile because you have missing teeth, here's how Mini Dental Implants will change your life.
I was in a car accident and I had a fractured jaw.
I have 4 teeth missing in the back.
I couldn't hide it any longer.
I'm gonna go and get this done.
Because you don't want to go around without teeth.
Getting the Mini Dental Implants was a life changer for me.
It looks natural, it feels natural.
It's more affordable.
Very affordable. It's well worth it.
It doesn't hurt.
What pain.
Now I can chew like real people.
I don't have to put all the goo on.
With these, I can eat everything.
I don't have to worry about being embarrassed going to a restaurant.
I wish I would have got it done a long time ago.
It's the best decision I ever made.
It hasn't made my life easier, it sure has.
Mini Dental Implants have changed my life.
I feel a lot more confident, my smile feels better.
They gave me my dignity back.
It's been fantastic.
It's been wonderful.
Now I have my smile back, and that's really nice.
It's just so much better.
I do smile a lot now.
My dental implant has changed my life.
I'm excited to be me again.
Well, now I don't have to worry about it. I can laugh however I want to.
I love it.
Hello, everybody. Welcome to Innovations in Health. I'm John DeSciullo, welcoming Dr. David Keller. We're going to talk about the Mini Dental Implant. Dr. David Keller here in Vancouver and with keller.mdica.com, part of the Mini Dental Implant Centers of America. Dr. David Keller, welcome to the show.
Thanks, John. Good to be here.
Yeah, it's good to see you. And the Mini Dental Implant really does change people's lives.
Absolutely. It does.
And one of the reasons that it changes people's lives is because it's so advanced from the conventional implants. And you have a model to start the show to tell us about why the Mini versus the conventional is so interesting. Let's take a look.
Absolutely. So, John, you can see here in the model, the size of this is a Mini implant, this is a conventional implant. So many people have been told their entire lives, you cannot place implants, there's not enough bone. Mini implants were designed for them to solve their problem. It's so much smaller and less invasive. It is so much faster in the healing. It solves many of their problems all in one simple procedure.
Yeah, and I understand with a conventional, there's time spent, to graft the bone.
Absolutely.
There's time spent for healing. There's, as you said, more stitching and more surgery.
Right.
So the Mini is just a smaller incision going into the bone.
Correct. Yep. We don't have to cut skin off of the bone either, right? So the healing is much faster, like you indicated. The need for grafting is much less.
Yeah.
Absolutely.
And I'm going to take that model from you because
Please.
if you have dentures, all right, and you want to take a look at what Dr. David Keller is going to show us, because if you have a lower denture and you're used to that denture moving around and not being steady, not so much anymore. Tell us why.
Imagine how this would change your life. Here's your denture. We've placed some mini implants, 4 little mini implants in the bone, and then you put your denture in and it snaps into place.
Just the stabilization must be an immense relief.
Life-changing.
Yeah.
Yep, life-changing, absolutely.
So someone that has a denture
Yes.
who is struggling with this, they don't have to do that anymore. I guess the conventional sort of old school thinking is, I have a denture and I have to just endure with the goop, all of that adhesive that
Right.
you end up swallowing. Not so much.
Not so
anymore.
much, right? You can do something different. Like I use the analogy, we used to, unfortunately, when we amputated a leg, we gave you a peg or a pair of crutches and said, good luck with life, right? Now we put a robotic leg on the stump and you walk again. It's the same thing. You do not have to suffer with dentures.
Yeah.
I wanted my smile back like I had when I was a younger person. I had my procedure a few months ago and it went great. No problem, I love them. I truly thought that it would be very, very painful. And I was amazed that it only took a little over an hour, and when I went home, I could basically eat everything again. Everyone notices, that I smile more, and my confidence is better now than it ever has been. And they're amazed how it changed my whole life.
So if you have dentures, everybody, and the Mini Dental Implant procedure could be for you, you want to stay with us for the next half hour because we're going to talk about this revolutionary technique. I'm going to take this from you because the next model you have is something that, well, let's just say if you want your taste back, if you want to dig into all the great food that we love here in Vancouver and Portland, this is going to tell us the best.
So patients routinely complain about the fact that when I cover your palate with a denture, their food tastes different. You can cut the palate out if you put many implants in. And again, your denture will lock into place, but now you have less plastic in your mouth, your speech can improve, and your taste definitely improves.
And one of the things we love to bite into here in the great state of Washington are apples.
Absolutely.
The apples are going across the country, so why not enjoy them right here in a way that you can enjoy them all over again if you have a denture.
Well said.
So the mini dental implant, Dr. Keller, is 5 times less because it's less invasive, less pain and discomfort, less healing time, less visits to the dentist, less expensive, and it gets better. We just showed you the lower and the upper example. Now we have something that really resembles a full set of teeth. What is that?
So this is what we call a fixed on sixth. And what we do is we put in the same amount of implants for stabilizing a denture, but we make you a prosthesis. We make your teeth out of zirconium, like regular crowns and bridges. And when we put this in, it gets put in and it only comes out at the dental office.
It looks like a full set of teeth.
And feels and functions like a full set of teeth.
Without the plastic of a denture.
Correct.
Yeah, that's incredible. But
it gets better.
It does. Dr. David Keller to show us how.
So this is the ultimate, right? We place 12 mini implants, and then we make the same sort of a roundhouse teeth out of zirconium. We glue it into your mouth, and it stays there permanently.
So you affix that into the patient.
Absolutely.
And this could be in an upper or a lower.
Absolutely. Yep.
So as if God gave us our first set of teeth, and then our adult teeth, you're going to give us
the third set.
The third set.
And final set of teeth.
And it looks terrific, and it must feel so good for the patient. And this is an upper lower, and it's as if they have been reborn again.
They come back to being who they were before they lost their teeth.
Yeah. Now here in Washington State and in Portland, you know, a lot of activity outside, a lot of getting out into the outdoors. Somebody may have had an accident, somebody might have had an issue, but the mini dental implant can help that, because if you have some teeth in the back and you're thinking, well, nobody sees them, it's out of sight, out of mind. No, you need to make that fix, because you need to eat properly.
Correct.
Show us how the mini dental implant can help.
Let's start with the first one. Imagine you fall down and you break this tooth. You can come into my office and I can take the remaining part out, place a mini implant in immediately, and make you a temporary tooth. Take an impression in a week, you come back, your permanent tooth is glued right on top of that.
And this is something that's not ripped out of a box and just placed in your mouth. This is a custom-made
It's custom-made for your mouth and your smile.
And we should mention, Dr. Keller, these are custom-made in America.
Correct.
Yeah,
Yep,
so this is
they
an
are.
American-made tooth, and the titanium posts as well. The titanium post, by the way, is sort of like your thumb, and it fixes right to it.
Glues
Doesn't
right
move.
onto it. Yep,
Yeah.
absolutely.
So the side teeth, tell us why it's so important to get those back teeth fixed.
So here's an example of a bridge. This patient is missing these teeth. They haven't been able to eat. So you can make a bridge and glue it into their mouth just like in the front, and they can eat again. Now, nutrition is immensely important in our overall health and well-being. If you do not have teeth, you cannot eat nutritious foods. You can't chew salad and carrots and lettuce and so forth. And because of that, you threaten your overall health. Restoring that it's an investment both in quality and quantity of life.
And I would think, too, that your mouth would not be formed properly if the back teeth are missing.
Over time, your bite will collapse and your ability to function properly will decrease.
Yeah.
Absolutely.
Well, keep that model in front of you, because I want to talk to you about you. Tell us about Dr. David Keller. Where did you grow up?
So my dad does construction, so I've lived all over the Western United States, mostly in Washington State.
Yeah.
I went to high school in Olympia. I went to college in Utah, dental school in Seattle, and I did a residency with the Army at Fort Bragg in North Carolina.
And in addition to the residency, I have to thank you for your service, because you served our country in Kuwait, I believe.
In Iraq, yep.
In Iraq, okay.
Yep, in Iraq.
Yeah. And what was that experience like for you?
So as a dentist in a war zone, I'm a triage officer. So actually what I did is we were part of a combat hospital, and when casualties would come in, I was the one who determined how to fix them and in what order to fix them.
Wow.
And it was thrilling. It really is a privilege to serve for our country.
Yeah. Well, thank you for your service. Tell us about how long you've been in practice.
So I've been in practice just over 20 years. I did 12 years in the military, 6 on active duty, 6 on reserve, and the rest in private practice in Southwest Washington.
And your family?
I have 6 kids.
6 children. Dr.
Absolutely. My oldest is 20. He's serving a mission for my church, the Church of Jesus Christ of Latter-day Saints, in Germany, where we used to live. So he's kind of going home to where he was at as a child. I have a 17-year-old daughter, a 14-year-old daughter, 11-year-old son, 8-year-old daughter, 6-year-old son.
Wow. Busy
family.
Dr.
Takes
Keller.
all my time.
What motivated you to be a dentist?
You know, I realized from my personality, I love to help people. And my mind is curious, so I like finding and fixing problems. I wanted a career where I could both use my mind to get an education and my hands to do something about it. And dentistry is the perfect match of all those things.
And if you want to reach out to Dr. David Keller, he's at 215 Northwest 78th Street in Vancouver. And you're really serving so the metropolitan Portland area.
Absolutely.
Vancouver, and from the coast, you come on over. And the phone number, by the way, is 360-301-8900. And online, it's keller.mdica.com, because you're a part of the Mini Dental Implant Centers of America.
Yes.
We talked about the technology of the mini dental implant. You have technology in your office. I hear there's a device called the cone beam. It sounds like something from outer space. What is the cone beam?
So one of the challenges with implants is making sure where you place them, the bone is healthy and stable. And so we can take three-dimensional scans of your face so that we can be sure we put implants in exactly the right spot. And that's what it does.
And you have some other technological devices, I hear, that you work with.
Absolutely.
Yeah,
one of the ones that I love is called LPRF. And basically what I do when I do surgery on a patient is I draw their blood and I spin that blood in a centrifuge, and I can extract from the blood all of their normal healthy healing cells and make those into bandages to accelerate their healing. It's why many implants or extractions associated with it it's so painless and they heal so quickly. We're using the very best technology possible to accelerate healing.
You must be one of the few dentists in this area, if not the only one.
I may be one of the only ones that uses it, yeah.
We hear a lot about Botox, and Botox is mostly associated with plastic surgery. How does Botox work in your practice?
So many people, their challenge is because they first were missing some back teeth, their bite has collapsed and they've begun to destroy their teeth. Sometimes that causes problems with the strength of the muscles in their jaw. With Botox injections, I can make those muscles so that they cannot destroy the mini implants and the crowns that I put in their mouth.
And you've embraced this mini dental implant technology, and I know you leave here in Vancouver and you go all the way across country to Buffalo, New York. Tell us who you meet. Tell us who you meet when you go there.
So my mentor is Todd Shakin, who runs Shakin First and is the premier mini implant dentist in the world. And his group, these Mini Dental Implant Centers of America, we receive the best training anywhere in the world on how to use this technology to benefit our patients.
How long have you been working with Dr. Todd?
I've been working with Todd over 7 years now.
And on the website, all of this technology, Dr. Keller, is there, and you can learn more about it. So if you're watching and you're thinking you might be a candidate for a mini dental implant, if you go to keller.mdica.com, there's more information for people to find out more about it.
Yep, and testimonials and before and after pictures. There's lots of information.
Well, and part of the website will talk about sedation dentistry as well, because that's something that you offer.
So many patients, believe it or not, are afraid to come to the dentist.
Why would that be? Why are we afraid to go to the dentist?
I haven't figured it out, but what I did figure out is I do IV sedation or oral sedation. So yes, I do have some fearful patients, and I have patients with special needs that I have to put to sleep to treat them safely, and we do that.
Yeah. And the website will tell you all about that. And so if we come together as a patient and a doctor, what's the consultation like?
So my job is to figure out why you're here. What is your need? And then to help you solve your problem. Most people, they simply didn't know they could change their life. And I teach them that they can and how they can.
And it's a free consultation.
Of course.
Yeah. So when you meet with the patient, maybe some of them don't need a mini dental implant. You'll work with them on whatever their need might be.
Absolutely. Yeah. One of my advantages is I'm a comprehensive dentist, and I was trained comprehensively. And so I look at you as a patient. I give you options to solve your problems.
When you have the consultation, I'm sure the cost of the mini dental implant comes up.
Always does.
Obviously.
Yeah.
And we're used to, as a nation, buying cars on monthly payments and buying major appliances and paying for them on time. This is something you will work with the patient.
Yep. We work very hard to figure out how to get you from where you are to where you want to be. Payment plans are a necessity in healthcare. They always are.
Yeah.
And we work with the 4 best and easiest to work with lending organizations in our country. Care Credit. Most people know Care Credit, and they know that it can help them.
And you'll work with the patient, so you're not going to leave the office without figuring it out.
Yep. We will solve your problem.
It's very important. And we should mention, everybody, this is an investment in yourself. Some people put it off. I had some major dental work done, put it off for a long time. Why? Who knows? But I worked it out. I did the Care Credit. I did everything that you talked about. And as a person, you feel better about yourself.
It literally changes who you are.
Yeah. And so you have to do that, whether you're getting involved maybe in a new relationship, a new job, or just reinventing your life. And it doesn't matter your age.
Right.
Yeah, I would think that someone who is a little older with the dentures that we just showed would want to come in because they want that stabilization. They don't want that embarrassment of the denture falling out or taking it out at a restaurant.
It's interesting you say that. We get many patients who get to a life event. My granddaughter is going to get married and I don't want to show up with dentures. Or, you know, I'm tired of going to my class reunions and being embarrassed about the fact that I had a beautiful smile and now I have dentures.
Yeah.
Getting the mini dental implants was a life changer for me.
Not a second thought about it. I would do it again.
This is something that is so incredible.
I feel a lot more confident. My smile feels better.
And it brought a lot of confidence back to me.
I feel like I do have more confidence than I did before.
Totally pleasantly surprised at this whole dental experience here.
Those patients are so important. When we talk about where you're at, Dr. David Keller,
Yes.
215 Northwest 78th Street in Vancouver, where's a landmark? Where can we come to see you?
So
Where
we
close
are
to?
directly across the river. The I-5 bridge crosses Washington and Oregon. We are right across the river, right off of I-5, within a block of I-5.
So we should all know where that is.
Absolutely, it's very easy to find us.
And you do some cosmetic work as well.
Of course, yeah.
So you work on that.
Yep.
What's nice about this community, you give back. And tell us how you do that.
So currently what I do, I teach at the dental schools. So there's a dental hygiene school that I teach at. There's an assisting school I teach at. I'm very involved with the Boy Scouts of America, I always have been.
Yeah.
We host free dental days like many dental offices do. A couple of years ago, we were in a parade in our local community.
Sure.
And we're always trying to figure out what can we do to help people. People need help and we want to be part of that problem.
What do you
solution.
find? What do you find when you're talking to the students? What are they most interested in?
Well, students want to get from A to B. That's their primary concern. Many students want to know, is there hope in our profession? Like if I, as a 20-year-old or a 25-year-old, if I join this profession, will I be able to retire in it? And I say absolutely, right? Dentistry is an amazing profession to be in, and it's amazing to see people's lives literally change. To people that are ashamed of what they look like, to have tears of joy in their eyes, to give you a hug and say, thank you for giving my life back. I mean, that is definitely worth pursuing.
Now you're a young guy. You've been in practice for a while, a couple decades.
Yeah.
The technology's changed even in that short window of time.
Oh, absolutely. Yeah.
So imagine what those students will be faced with as
Right?
advancements continue.
Yeah.
We talked about testimonials and people that you've connected with, and we talked about the fact that you're a vet, and you have a real important story to tell about a Vietnam vet that you helped.
Right.
Tell us about that.
Okay, so I have a patient, Danny. Danny has no teeth, and he could not get care at the VA, and he had been told for 10 years, hey, you are not fixable. I'm sorry, but you just can't be fixable. And he found me somehow, and he says, Dr. Keller, can you do anything? And I could. I was able to put mini implants in on his bottom jaw and restore him to the point where he can eat and he can smile. And his comment to me was, thank you for giving me back my self-respect.
Wow. And here's a man who served his country, many, many years ago.
As a combat vet, yeah.
Wow.
Yeah.
And tell us about Dorothy.
So Dorothy is interesting. Dorothy is extremely afraid of the dentist, and Dorothy had some missing teeth and had been wearing a flipper for a long time, and she hated it. But she just couldn't go to the dentist because she was too scared. She came in, we put her to sleep, we put her implants in, and when she came out of the anesthesia, she had teeth in her mouth and implants in her mouth. And she's so excited, she took her denture and she put it on the ground and she jumped on it and broke it right in front of all of us. I'm never gonna have to wear that again.
You didn't capture that on video, David?
I don't know that I did.
Yeah.
I should have if I didn't. Yeah.
That's amazing, and that's the kind of joy that you bring to people.
Absolutely.
Yeah.
Yeah, that's why she did it. And it was really cool for all of us to see how excited she was to finally get this monkey off her back of wearing this partial that she'd been wearing.
And flippers, that was, it's an old TV show.
Yeah, right?
Flippers are gone. When we talk about the mini dental implant and dentures, most people associate that with someone who's a little bit older,
Right.
but the mini dental implant can be for somebody 18 years old.
Anybody missing a tooth. We do a lot of patients who are born without their laterals on their top jaw. And we put mini implants and crowns in very consistently.
Yeah.
We work with the local orthodontists for things like that all the time.
And we should mention Dr. David Keller, this is his specialty. David is a part of the Mini Dental Implant Centers of America, and Dr. Keller's at 215 Northwest 78th Street. If you haven't figured it out by now, it's in Vancouver, and here's the phone number. It's 301-8900, and here's the website again, keller.mdica.com. Are you on Facebook?
Yeah,
Doctor?
we are.
Yeah.
Yep.
So you want to put some of those patient testimonials there too?
Absolutely.
Yeah.
Yeah.
We talked about the fear of the dentist, and some people I think just naturally put things off, whether it's
Right.
going to the doctor or the dentist. And it's important to go.
Yeah.
You have to get a cleaning.
Of course.
Yeah.
Yeah.
You have to get a checkup.
I think one of the things we strive to help people understand is the value in what you're explaining. That regular maintenance on your automobile is what makes it last so much longer, right? Same with your body, only so much more important. It's your body, right? Regular maintenance is key.
And if there's a dental problem that you have, it's going to be made worse if you don't go.
It'll be more expensive and worse.
Yeah.
Yeah.
The mini dental implant, we say it's 5 times less invasive, less pain and discomfort, less healing time, less visits to the dentist. Not that we don't want to go see Dr. David Keller, and it's less expensive. And your wife is involved in the practice.
Oh yeah, she's our office manager.
Yeah.
Yeah.
So
it's
she
fun to
keeps
work
you
with
in
her.
line, Dr.
She
David.
does.
Yeah.
Well, her and the rest of the ladies.
Yeah.
Yeah.
So you have a good team.
We do. We love working together.
Yeah.
Yeah.
When we talk about pain, and is one of the fears of going to the dentist, we should really discount that now, because how do you treat the pain, it's so minimal, with the mini dental implant?
So even if I put in 20 mini implants, usually we recommend you take ibuprofen or Tylenol for a day or so. And it's uncommon to need to take more than that or longer than that.
So an over-the-counter medication
Yep.
in a very
Same thing
short
you do for
window,
headaches.
just for
Yeah.
like 24 hours.
Correct.
Yeah.
Yeah.
So that's why this is so revolutionary. So if you're out there watching and you're thinking, I need to connect, you do need to connect. If you have another dental issue, Dr. David Keller will look at that too. But the mini dental implant, that's what we really are focusing on here.
Right,
And,
right.
how do you care for the mini dental implant?
So we give all of our patients a water pick, which is a water flosser. It allows you to clean around the implants completely, appropriately, easily, and it's predictable. It keeps them healthy.
Yeah. And it's
Yeah.
good common practice for anybody to use.
I
a
use it
device
every
like
day in
that.
my own mouth on my
Yeah,
teeth.
absolutely. You need to do that.
Yeah.
You know, I'm going to start again to talk about these models, because if you're just joining us, we're talking about the mini dental implant. If you've been with us for this whole program, I think now these models will make more sense, because now we're learning why this is such an amazing technique. So again, if you have some back teeth
Yes.
and you've given up on them, don't give up on them.
Nope.
The mini dental implant can help. Show us why.
Come in and let me I put in some little mini implants just like this. I make a bridge just like I would on natural teeth. I glue it in on top of those, and look, it looks just like teeth, and it functions and feels just like natural teeth.
And the single tooth example, show us that again. And it doesn't have to be in the front, it could be on
Nope.
the side or the back.
So again, imagine missing a tooth or having a tooth that just was recently broken. You take the tooth out, put a little mini implant in, make a crown, glue it into place. It looks and feels just like teeth.
And when we say the implant, again, that's the titanium post that
correct.
goes into the bone and the gum.
Yep.
And the tooth affixes to that.
Glues right onto it.
Yeah, stops right in.
Yeah.
All right, I'm going to take a look. I believe this is this the upper or the lower?
That's
Doc?
the lower.
Let's show us that, because the lower dentures, we said, and my mom had dentures, and I was used to they were moving around and the goop and everything. Goop is gone.
Goop is gone.
Throwing it out.
Right?
Because you have
Number one complaint is they move. Put in some little mini implants just like this and some snaps inside your denture, and your denture goes right in and it snaps into place. It doesn't move around like it did.
So someone comes in with a denture, you'll work with them with the dentures they have.
Yeah, many times we can just put the implants in, add it right to their denture.
Yeah.
Yeah.
I'm going to show you the upper, because as we said, in the great state of Washington, we love apples. They're shipped all over the country. Why not enjoy them like the rest of the country does right here in our hometown with the great taste? And steak and corn on the cob, the palate is back.
The palate is back, right? So again, place mini implants. Take your denture, existing denture, cut out the palate, or make a denture without a palate. When that palate is uncovered, your taste improves. Your ability to enjoy your food improves.
I had a lot of difficulty in eating.
But with these, I can eat everything.
It was done, overdone. Go home and eat.
I don't have any problem chewing anything.
And my teeth aren't falling out of my mouth.
This is something that is so incredible.
It's made a tremendous difference.
If you're missing teeth, I would just recommend it highly. I'd get as many as you could.
I'm very, very pleased that I have them now.
The reason that people need to know this is because the mini dental implant is so far better than just having a denture.
Right.
Don't accept that you need to have those old dentures and just muddle along. But it gets better. Show us the fixed on 6. I'm going to give you these two models because this is as if God's going to give us a whole new set of teeth again.
So I like to show, look at the difference between these. Which one would you want in your mouth? This is plastic and it's bulky. This is zirconium, the same thing crowns are made out of, right? I can make a full set of teeth that snap in over your mini implants, and this does not come out of your mouth except at the dental office.
Interesting.
Permanent teeth back.
And as if God's going to give us a third set of teeth, show us that.
Here is our favorite. Here we place more mini implants, and then we take the same kind of a zirconium bridge, we glue it in just like a crown. This never comes out of your mouth. You are back to a full set of teeth that look and feel just like natural teeth.
And one of the most amazing pieces of this, and I think this is what viewers are going to watch now and go, I don't believe it, but they should believe it. It happens in your office.
Absolutely.
What's the time frame from the beginning of a mini dental implant procedure to the completion?
So if we have everything that we need to get started, you can come in and have all of these placed and a temporary one of these placed under 2 hours.
Under 2 hours?
Easily.
It sounds too good to be true.
No, this is something that we do all the time. Patients just don't know that the technology's there. When they had their teeth taken out, they were told, here's your denture, it's the best we have. That's not today.
And this happens.
This is what we do today.
And this happens in your office?
In our office,
Yeah.
Yep.
This is amazing. The mini dental implant procedure. Dr. David Keller, 215 Northwest 78th Street in Vancouver. Tell us the areas that you serve again, Doc.
So we serve the Southwest Washington, we serve the Portland metropolitan area.
Yeah. So all of the viewers who are watching, if they have a dentist and they go to the dentist, that's great. But if they need the mini dental implant, they really need to come to you.
They do.
Yeah, because you are the specialist in this.
And there's unfortunately too few people that are trained to use the technology. And it solves so many problems. We definitely want them to come and see us. We can help them.
Yeah. And you want to see Dr. David Keller. Here's the address again, 215 Northwest 78th in Vancouver. The number 360-301-8900. The website, keller.mdica.com. It's been on the screen for the program, so write it down. And the Mini Dental Implant Centers of America, that's who you're going to connect with. That's where Dr. David Keller is associated with. Before we wrap up, Dr. Keller, I'm going to have one more time show this because I don't think there's any better example than this to really bring home the difference between the conventional and the mini implant.
So many people have been told their whole life, you don't have enough bone. These mini implants are very, very narrow. And look at how much less metal is actually placed in your mouth. This explains why they heal so much faster, why there's so much less discomfort, why there's so much less invasiveness. It's because they really are very narrow, very long, strong, conventional titanium implants placed right there on the bone.
And with the older, more conventional implant, it's a screw and then a screw.
Correct.
Yeah.
And then a crown on top of it.
Yeah, so a lot more to it.
A lot of moving parts.
As we wrap up, what does it mean to you to be a dentist?
So one of my great thrills is helping people improve their lives. And that's really what I enjoy about mini implants is the people who are the most discouraged, who are in some ways the most disabled in their oral health can be restored back to optimum health. And that's amazing. I mean, literally we watch people's lives be saved from discouragement and from hopelessness.
Yeah.
That's a pretty fantastic high.
Well, you're a pretty fantastic guy, Dr. David Keller. He is an innovator in health. Thanks for joining us on the show, and good luck to you and your family.
Thanks, John. Appreciate it.
Thank you. And thanks for watching, everybody.